Hello and happy Sunday morning. How are you today? This is a brand new week with brand new opportunities. And guess what? I am talking about a brand new experience this morning. Can you imagine your baby is 12 months old already? It's like, where did the time go? But you're not just asking where did the time go. You are so excited because you're seeing that little personality growing and your baby is developing into a person. Fantastic. You are seeing so much growth and you are able to interact. So let's talk a little bit about what your baby is doing at 12 months old. From a social emotional perspective, your baby can play games with you. Now you have a partner. You can play games together. Games like patty cake, patty cake, bakers. Man, you can play that game with your baby from a social emotional perspective. So he or she is engaging, and you, I know, are just loving it. What should your baby be able to do in terms of language and communication? Now, your baby should be waving goodbye. He or she should call for a parent, mama, dada, or another special name. You should hear some of those words coming out of your baby's mouth. And the under language, your baby should understand stop, or should be able to pause briefly or understand no. If the baby's going towards to do something that you don't want him or her to do, and you say no at 12 months old, your baby should understand no and stop or pause for a minute when you give that direction. Now, this information I'm sharing this morning comes directly from the CDC, and I want you to be aware of where your baby is, what your baby is doing, and so if your baby is not developing appropriately, you can get the help you need. Now, 12-month-old babies, when it comes to cognition or the way they think or learn or problem solve, they should be able to put something in a container like a block or a cup. So you have a container and you're probably singing the cleanup song. Your baby should be able to pick up the stuff and put it in a box or put it in a cup or do whatever you're asking. Or even when they're feeding, they're having breakfast and you give them the little Cheerios, they should be able to pick them up and put them in a bowl. Your baby should be able to look at things that he or she that you hide, look for them like a toy that you have hidden under a blanket. So again, object permanency is developing here. And at 12 months old, your baby should be able to look when you hide things, look somewhere to find them. What is your baby doing in terms of movement, physical development? Your baby pulls to stand, and for some babies, they're already walking at 12 months old. Your baby walks and holds on to furniture, and your baby drinks from a cup without a lid as you hold it. So it's not a matter of where, the baby is controlling the cup completely. You remove the lid and you're helping the child as he or she drinks from that cup. And then from a motor perspective, again, finally, your baby can pick up things in between the thumb and pointer finger like small bits of food. I mentioned that earlier on the cognition, but he or she should be able to grab things between the thumb and the pointer finger like the Cheerios. So you want to encourage opportunity to use those tiny bits of food, but make sure your food is appropriate and it wouldn't cause any choking for your baby. Now, like I normally do, I want to add a few opportunities or activities that you can use as your baby is in this special time of development. Use these activities to help your baby to continue to grow. Teach your baby wanted behaviors. We said this in for babies in 9-month old who are the 9-month old developmental stage. Teach them the behaviors you want them to do. Instead of saying no, tell them what you want. You know, show what you want them to do. Use positive words, hugs and kisses when he or she does what you ask for. Now, you want to keep talking and singing to your baby, and do this when you're doing activities with her. Like if you are putting on the clothes, you're saying, Mommy is putting your shirt on. If you're washing baby's face, you say, Mommy is washing baby's face, baby's face. You know, create songs and use words and language and vocabulary so your baby can develop in this area. You want to build on your baby's tries to say, build on what your baby tries to say actually. If your baby says ta, we talked about that earlier, say ta, or you can say truck, or you can say train, anything that builds on those initial songs that you are hearing coming from your baby. Redirect your baby quickly and constantly by giving him a toy or moving him or her to get in things when he or she's getting into things that you don't want them to get into. Don't say no, just redirect. We have a tendency to use that no word way too much. Just move him along. Take him to where you want him or her to be. Give your baby safe places to explore. Remember, we talked about this before. Baby-proof your home. And you want to respond with words when your baby points. The baby points to food. You say banana. The baby points to the door, you say door. The baby points to a toy, you say car. So you want to use words again. Just use a plethora of words so baby can hear and learn and understand, and the brain can grow and develop. Point to interesting things in your baby's environment. You know, if your baby is a boy, he's going to be into trucks and cars. So you want to be like pointing to all of the things that he loves. And babies love lots of animals. Point to those and show through pointing the different things that exist in the environment. I would even say at this point, you start to label things like the refrigerator and oven and kitchen and door, and so that when you say the word, the baby is seeing it and he's seeing the object. Limit screen time. I'm not going to go over that. This is a no, none. This activity should not be in existence at the age of 12 months old. I said this before, no child should be exposed to screen time until after the age of 2. You want to help your baby use foods with different taste and texture. So we are continuing the introduction of food, and you want to give your baby water, breast milk, or plain milk. You don't need to give your baby any juice, and I want to reiterate this. We don't need to give baby any juice. Water, breast milk, or plain milk is sufficient for your baby. Do not give your baby any sugary beverages such as fruit juices or soda drinks or flavored milks. Again, do not give your baby any sugary beverages. And of course, baby should not be eating candy at this point. Okay, so now you want to give your baby time to get to know new caregivers. A new caregiver, okay? So bring a favorite toy or a stuffed animal, a blanket to help to comfort your baby when you take him or her to a new caregiver. So you're introducing new with the old. It's a combination. So there's some form of comfort and familiarity for your baby. Now you give your baby pots and pans and small musical items like drums or cymbals. Why is this important? This is going to encourage your baby to make noises and also to coordinate his hands, coordinate the use of his hands. So he's banging on the toys, give some spoons, and along with the pots and pans, so that he's really exploring and touching and coordinating the both sides of his brain. I know that you are like totally, totally in love with your baby at this point. You are so happy at what he or she is doing at 12 months old. And I encourage you to continue to work with your baby and teach him or her the wonderful, wonderful new things that he will learn as he continues to grow and to develop. This is Dr. Yonette telling you, talking to you today in our episode of Baby Talk about your 12-month-old and saying, take care of baby and take care of you. Thank you for joining me and have a great day.